Tuesday, October 6th. So recovery coordination team meeting, probably in this structure will be the last one for a period of time. And we'll talk through that this morning. As you saw my note yesterday that we're blending this group with another unified command, basically a version of the Education Unified Command. So there'll just be one structure moving forward. But before we get into that, I'd like to just give everybody an opportunity to, it seems like it's been a while since we met. Maybe has it just been 2 weeks or longer even maybe? Give everybody an opportunity to just report out on any work you've done and share anything that you feel like others need to hear about. And let's start with RSF1 economic recovery.
Good morning, everyone. This is Diane. I don't see that Steve is on yet, but I'll report for our group. Oh, there's Steve.
I'm here.
Sorry, Steve. Didn't see you there. I was searching my screen for you. So our group, we have been working on some updates to our goals and objectives for our RSF1, which we have shared with our larger group and are in the process of updating. We're hoping to have those finalized here really soon, just kind of working on some additional feedback on those. And Steve, do you have anything more to add?
Not a lot. We had some really good discussion at the last meeting when this was discussed, and we just felt like we were at a point where we needed to have a little bit more meat on the bone, I guess is a term to use, for our group, and so are headed in that direction, but are looking for input, and then we'll go forward from there.
Great. Thank you, guys. Anybody have any questions or conversation around RSF1? RSF2? Beth?
Sure. RSF2, since the award of all the direct aid monies, what focused its time over the last 3 meetings on conversation around transportation of issues for COVID positive discharged patients from the hospital. Had productive conversation on that. And the majority of, or not the majority, but a lot of RSF2 leadership folks across the continuum have really been involved in the ongoing surveillance and vaccination planning for the county, as well as focused on the development of data and benchmark and dashboards to help them do ongoing communication of the evolving place that we find ourselves in with respect to the disease. So we're an RSF that has been a proponent of relooking at structure, because as an RSF2, some of the most pressing work is happening outside of an RSF2 in those other public health and healthcare delivery spaces that involve other people on this group. So that's our update.
Thank you, Beth. Appreciate that. Anybody have anything for Beth or RSF2? Is Jill Jolliker on here? I'm not seeing her from 3 or.
I see Jill's name.
Yeah, I'm here.
Oh gosh, there you are. Hey, good morning, Jill.
Good morning, Robert. How are you?
It's okay. Good.
RSF3 is just lots of good things happening. The housing stabilization program is rocking and rolling through tenants to homeowners and family promise. Things are kind of stable with food supports and with Just Food transitioning over to begin the capital improvements to their operations. And then let's see, congregate site, we've just been continuing to make sure the connections are made with answering questions with at the health department. And then on our unsheltered homeless, this evening, The city commission will be reviewing the temporary special event permit that will be required to be approved to move forward with the sanctioned campsite, hopefully beginning in November, that we're diligently working on with the city team. And then on digital equity and inclusion, the county slash and city libraries in Lawrence and Baldwin and Eudora have collectively been invited to be a part of the Kansas City Digital Inclusion and Equity Alliance, which is convened on a monthly basis with leadership from all over the KC metro area. And it's just talking about how digital equity and inclusion can be more strategically addressed at a local government level. There's a few of us that are meeting with Rick Usher, who's one of the assistant city managers for Kansas City, Missouri, at 2 o'clock today, some of the stakeholders that have been engaged in that work so far. Jim Wisdom with the city and Michael Aldridge with the city IT department in Lawrence, and the library in Lawrence, and Jim Lawson with the county's IT department, so, and the school districts as well. So lots of good stuff happening. Happy to stand for questions.
Thank you, Jill.
Robert, this is Beth. One thing I realized I should have shared from, it was kind of an evolution from RSF2. As Sonia Jordan has worked with a vaccination planning team, we are one of our two equity impact advisors, Alex Kimball Williams, was assigned to be embedded and work with that team and their research around equity impact. So we've kind of morphed supporting those endeavors. So just to have shared that.
Thank you, Beth. RSF4, Julie.
Good morning. RSF4 suspended its meetings while the Education Unified Command met twice a week, and all of our Douglas County schools are back in session except for Lawrence, and we're easing our way toward trying to get kids back at least 2 days a week in about 2 weeks. So that's about it.
Thank you, Julie. Any questions for Julie or conversation around education? There's a lot of conversation around education, but it's ongoing, obviously. Let's just, George, do you have anything from public information world?
Well, and I apologize, I can't get my video to come on. I mean, I think the biggest thing we were able to start this week, continuing the digital campaign using CARES Act funds with Great Plains Media. That's been an ongoing radio campaign with, it's geared, the key audiences are that college students and then parents of K through 12 students. The digital ads have started, and then we also have some bus signage and ads that will be added on the buses soon. That's in progress, and some other things that we're looking to do. But the key to the campaign, I guess the key message is my mask makes it possible. Those smart and safe habits, just kind of continuing that and focusing on those key audiences. A lot of our other work at just PAOs, we have a meeting later today, that the ones that basically touch this group, but just continuing to support kind of the community response, and just as we broaden it out and hopefully get to recovery. And then, like Beth mentioned, with the vaccination planning, we are planning with Alex Kimball Williams that she talked about. We're working on a survey that would go out targeted for next week. So there'll be a lot of communication and push, and we'll ask your all help as partners in distributing that to everyone in the community, just to help us identify kind of the level of just kind of where people in the community are thinking as far as, when we do have a vaccine available for COVID, just their general thoughts about it, their level of trust, their questions about it, what they're thinking. And ideally that would help us. There'll be a digital format and then also a paper copy format to distribute. But that would just help us inform our communication strategy around that when that kind of elephant comes down the road. in addressing that. And we can hopefully identify some key strategies and different ways to reach different audiences and help the vaccine distribution be as successful as possible.
Thank you, George. Questions for George? Logistics, we have a new face. Jordan, did you have an update for us?
Yeah, good morning. Not a ton from yesterday. We continue to send out the PPE survey, and like we've talked about, one of the big changes is notating the critical need for PPE. With that, if a critical need is notated, we're just simply requesting documentation that an item is on order and it's not going to arrive prior to them running out of that item, thus resulting in a life safety concern. So facilities have been doing a really good job with that. Another thing we worked on recently was a community PPE. Those were the donations from Johnson County Health Department. We were able to get all those delivered last week. I think we had 9 or 10 total facilities that requested PPE from that cache. So yeah, just kind of clarifying with facilities on what the guidelines are going forward in terms of documentation needs, and then trying to fill those gaps wherever we can.
Thank you, Jordan. Anything for logistics? I would offer any of the equity impact advisors on the call if they have any input this morning.
Good morning, everyone. The EIA group has been working to put together some language to go through the framework that we spoke about for this group. I'm excited to hear about the merge or the change over to Unified Command and how that might impact what we're writing. So we've been pretty active as a group. We're excited to continue the work as we move forward. Erica, Leah, you have anything to add? Casey, sorry.
No, thank you, Elizabeth.
And Jasmine, sorry.
Okay, well, thank you. Thanks for being here. Appreciate it. And I don't see finance, and I'm going to ask Sarah, is there anything we need to know, CARES related or finance wise, that we need to pass on to this group?
I think Brooke's working real hard to just make sure everyone's got their guidelines and policies passed and the agreements put together. I know I'm signing lots of those, and approving purchase orders, so cash is moving out the door. So appreciate folks helping to get those things signed so we can move the money out through the community.
Great.
That's it.
Appreciate it, Sarah. I guess, we'll, I see quite a bit of the coordination team. Almost everybody's on the call. So I think this may be a good time to talk about the transition as we merge into a unified command. So let's, Jillian, can you bring up the chart? Everybody should have seen that if you looked at your email yesterday, this structure. So as Beth brought up and has brought up over time, Beth Llewellyn, about still being in response. We know that education's been in response. And we've talked about how response and recovery, how they do go on at the same time. And a lot of the work while you're responding is you're also recovering and you're looking ahead. So thinking about that and thinking about having met the objectives in the Education Unified Command, we've come together with this, what we're just going to call a Unified Command, and we're going to bring in the RSFs and their work. And as you'll see on the chart, 3 of them look the same, education, housing, human services, and economic impacts. And, as health and medical continue to work together, you'll see they're in the operations box there, and that's how they're represented on this chart. So the idea is that when, as you see, vaccination planning, surveillance planning, when these types of things come up, they need work, they need plans. They would come into the structure, get the people that are needed to do that work, do that planning, do the work, and when it's operational, bring it over to operations with those objectives in mind. And then when that work is done, then they fall off the chart. And you know, in this way, we won't have to move to a different structure when we are faced with you know, some more significant events or problems to solve or resources in the community. So I could just briefly go over the chart. Obviously, you can look at it and see it. It looks real similar to what we've done. Most of you have probably seen this chart on this call. And the Education Unified Command, you'll see we don't have a finance section as we have in the past. And we felt that if there's a need to bring a finance section in, as in any other section or branch, we want to be fluid with this structure. So planning, working with emergency management, we're working with vaccination planning, surveillance testing, and then there's a personal support unit we added to this, and that's one of our staff in emergency management. And really what we're going to want Josh to do is, as we move through and work over several months, we just want Josh to track personnel, and you know, there's conversation about people burnout, and just bring up those topics when needed, and talk about, if you maybe suggest if somebody needs to think about swapping out somebody for a period of time, or however that looks to them. So that's what that personnel support unit is. The other new thing you'll see under operations, as you come down the branch, you'll see a community well-being branch. And so much of that work will be we've talked about how people are looking for some normalcy in the community, in the county, and they're looking for hope, and they're looking for ways to get out and feel better. And we talked a lot about that on Education Unified Command. And so the conversation came up. So we're calling it a community well-being branch. Mental health would be involved in that, as well as like arts and parks and rec, and those kind of things would work. And some, what you're seeing in these boxes are the leaders, and obviously there'll be more players that'll be on those teams as they do the work. You'll see that the health and medical are both public health and the hospital represented in operations. Jordan Snyder took over for Charlie in logistics here just a couple of weeks ago, and Pat Tabor's still there. We brought our liaison branch back in, and Sarah and Craig, and that's to have that connection with other organizations or entities in government or private that bringing them into the system. And if they have questions, or if there's information we need to take to them, and that's their role. Safety looks the same as it did in education. You see PIO, we're doing a little change, George and Carrie, and as you'll see JIC there, Joint Information Center. So they've been working with all the PIOs for several months already. So they work together as a team, but George and Carrie will lead that. And then equity, we were looking for leaders in equity, in the team. And so Alex, Elizabeth, and Erica we plugged into that box. But again, they're working with their team in this effort. And our Unified Command leadership has stayed the same as it was in recovery, and as it was in Education Unified Command. So that's a summary of the structure. It's close to being done. We still have a few names that we need. We're waiting on, and questions about the structure, comments, conversation.
Robert, can I add one thing?
Sure.
for our RSFs that have been moved over to branches, we want to highlight too that the work that you're doing to continue both the short-term and the longer-term conversations. This is more of a response type structure, but we want to make sure that those conversations are continuing to talk about steps moving forward. The goals that you all have developed and set forward to look for metrics to see what's working, what's helping, what's building our community, and taking care of them and looking for long-term issues that may come up so we can plan for those. So while you're not under the planning section, we would still encourage those conversations to continue in the way that they've kind of moved over from recovery coordination to here. Same box, it's just in a different spot with a slightly different name. So again, just encourage you all to continue that good work looking ahead while just incorporated into a new structure. That's all I have.
Thank you.
Thanks, guys. I think this looks great. This is Bonnie. So some of the specifics, you'll see Margaret Morris under Community Wellbeing, and I sent her an email, but have not had a conversation with her. So before you inundate her or say congratulations and I hope you got a big pay raise with us, I need to have a conversation. So we were plugging in names yesterday, but I don't know if everybody's been contacted, and Margaret kind of has, but not to the level that I need to have that conversation. So that's just a FYI for you.
Same goes for Patrick Schmitz. Have not gotten confirmation yet.
Okay, thank you. Any others like that on here that we can see? I think everybody else is.
Lee Ice may have no idea, but that doesn't matter.
Okay, thank you. Well, so if there's no other questions or conversation about the structure, just know that like today, as I said earlier in the meeting, that we will send out a calendar invite and stop this recovery coordination team every 2 weeks. So we won't be meeting as this team. We'll be meeting under this new structure for the RSF, and then the Education Unified Command met yesterday, and they will not be meeting on Thursday, so they're not meeting under that structure as well. And then the first meeting for this team will be next Thursday, the 15th at 11:30, and they're planning on those meetings Thursdays at 11:30, unless there's a need to up that or lessen that time frame as we move forward. And goodness, what else? Do you have anything else to add to that?
No, just that we'll be providing some documentation and some information just on what this, kind of how this works, how reporting works, since it's a little bit different. We can also include some NIMS and ICS training if this is new to you. Thank you, Craig, for the suggestion. We'll put those as links. They're online trainings. I will apologize in advance, they're dry, but it is helpful to understand how the structure works and some of the key principles of how NIMS, which is the National Incident Management System, and ICS, which is the Incident Command System, just how they work. It's a standard structure that we use across the country to respond to incidents. So we'll include some links there so that you can take some additional training, but we'll have information about what's required of each of the leads as far as reporting. There's not a hard for our branches of when you have to meet. As far as within your teams, we would encourage you to continue to meet as you see fit and as what's working for the team that you're leading. So no hard and fast there, just the Thursday meeting. So just a couple of actions, but we'll put that in a document so that you have a reference point for the expectations for the new structure.
Thank you, Jillian. And just so we can all take a look at the objectives, can you bring those up, the overarching objectives?
Yes, I can as soon as my computer will cooperate.
You have the circle of patience going? that thing?
Is that what it's called, Robert?
I named it that. I was being very patient one day and I thought there's got to be a name for this. So I named it the Circle of Patience.
That's
I
very
have not
optimistic.
Yeah, I have not yet come to call it that, but
I think it's a circle of frustration.
Frustration. Well, I was taking a more positive approach, but thank you.
I appreciate that.
Yeah. So here's what the Unified Commanders came up with, and so there's a mission statement. You can read it there on the screen, and then there's some overarching these objectives that you see down to where there's a space. Then those are the overarching ones, and then when you see like vaccination and surveillance planning or anything else that comes in to this under this umbrella of Unified Command, there will need to be an objective here, objectives here for that work. And then obviously each of those branches will have their own objectives and as the RSFs have all along, and then the new branch down below as well. So not planning on reading them to you, but we just wanted to give you a look. I don't know that did we send these yesterday, Jillian? I don't think we did. No. So Dan, I know we were going to set up a meeting. Dan Partridge you haven't seen these yet, so we'll go over these with you today or tomorrow in the meeting. And once Dan and we have that meeting and everybody is okay with this objective list as well as the structure from public health, then we'll get these out in a final version, hopefully this week.
Hey, Robert, this is Katie, and I'm wondering if, to avoid kind of the problem of last time, is it possible to have the equity advisor leadership team that you identified on that org chart weigh in on these? I think that might be helpful to do at this point, as opposed to you all get them to where you think they make sense, and then the equity advisors are kind of asked after the fact.
Yeah, I think that would be a great idea. And we'll get this list to your team after the call. And anybody, well, Elizabeth, can we send it to you and can you get it out to everybody? Okay, cool. We'll do that. Thank you, Casey. Sarah says she can't hear you.
Sorry.
Did everybody hear Casey? I heard her. So Sarah, basically, Casey asked.
It must just be me. She just was really quiet. I could just barely hear. I just didn't. Sorry, it just must be my phone, my screen.
Okay. All right. What else? Jillian, I'll ask. What am I forgetting here? Anything?
I can't think of anything currently. I think you covered it well.
Jillian, this is Steve Kelly. Will you be sending out, you or Robert, the meeting notices or the meeting invites for the Zoom call? Okay.
Yes. You guys will get an Outlook invitation, and then how we were working that with Unified Command was we did an overall reminder through our Everbridge call notification system, just saying, hey, don't forget we have a meeting today. And also for those that are submitting reports in, there's also a weekly reminder for that as well, so that you guys have the form at your fingertips, the reminders there, and who you have to send it to, so you don't have to remember. So all three of those will be set up after this call. And you'll also see, so just an FYI, you're going to see, especially if you're on both calls, you're going to see a bunch of cancellations because I had the meetings running for a pretty long period. So you'll see them canceled in one and then a new meeting for this new Unified Command. So I will apologize for the number of times I hear your inbox today.
Jillian, that's so helpful. Thank you so much.
Very welcome.
Is there anything from the leadership team? Anybody have anything that we may have overlooked or want to add to this conversation about this Unified Command?
This is Sarah. No, I would just say I really would be, interested in people's thoughts on this. I think our intent here was to try to create something that could evolve over time as this as the pandemic continues, and to try to make it flexible from that perspective, and also just provide the support the community needs. So we are really interested in what people's thoughts are.
So Sarah, would it be helpful to have that feedback here today in this forum, or would you prefer it to be emailed?
Well, I got another half hour. So if I think if folks have thoughts that now, I think there's no harm in sharing them now.
Okay. So I appreciate the objectives, and under, from looking through an equity lens, I think about things like, when we talk about distribution of strategy, plan and things like that. First thing that comes to my mind is making sure that we have that communication piece in multiple languages. That's my first thought.
I think that's great. I think those are kind of the things that are tasks and sort of assignments underneath an objective to just make sure that right. I mean, I'm not always real good on the lingo here with this stuff, but obviously I think that's what we want to do that. Do you think we need to, I don't know if we would add it to the objective though itself.
Yeah, I think that would just fall under the second one as identified as effectively communicating.
And part of Elizabeth, part of that task too can be a part of what like the group that is executing or working underneath that objective would have that as a kind of an overarching task of, as they communicate, to make sure that those things are in multiple languages, that the community speaks, so that it can effectively and maximize for those two words. So I think we'll make sure that that is included in the teams that are working on communications. That's a really good point.
This is Bonnie. Craig, I noticed that you put something in the chat about the objectives should be updated or revised at the beginning of every operational period. How do you define operational period?
So do you want this, Craig, or you want me to take it?
I would much prefer you take it, but I'm happy to speak to that. NIMS training would be my 2-word response.
Okay. Yeah. So Bonnie, basically it's our operational periods will go for a week long. So when we meet on Thursdays, we're going to ask for the input for the incident action plan. The incident action plan will start Friday morning and go through the following Friday morning. And as we've been working all along, we've had 2 meetings a week. So they've been, in between each of these meetings has been our operational period. Does that help you?
Yeah, you think I know that by now. Thank you for that.
You're welcome. But that's a good point, Craig. With objectives, we should review those at every meeting and make sure that we're still on point. And also, if we've completed an objective, obviously take it out. If we have a new one, put it in. So yes, we should do that every meeting.
And Robert, before we jump back to Elizabeth, because we will have an agenda for these meetings too, and that'll be a part of it, to make sure that we always go back to review those, make sure we're still on point. So we'll be adding a little bit more structure to how the meetings will run as well. That's what I.
Anything else from the group?
This is Erica. Yes, this is Erica. So on the objectives, the bullet point that starts with rapidly, and I am not an expert in response. I'm not going to pretend that I am. However, I attended several, been a part of several groups. Some are national groups, some are regional. They said that when we're responding, even, you know, for disasters or even like for COVID specifically, we can't not have an equitable response. You have an obligation to our community to ensure we are, to the best of our ability, ensuring an equitable response to COVID and everything else that's going on. So I'm not suggesting we add that language in there, but I would like for that to be at a minimum a consideration.
Thank you, Erica.
This is Craig. I would just note that we put it in the mission statement very intentionally so that that is overarching, not lost on any activity, and should be guiding every single activity.
And on the topic of equity advisors, Jillian and I met with their team a couple of weeks ago, maybe it's a little longer now. And, I think that from a facilitator point of view, that we plan to be more intentional with ensuring that the equity advisors are embedded or included at meetings, and that they have an opportunity to have input, and they're available as a resource. And we need to all remember that that lens is important, and that they're here for all of us, to help us. So yeah, I just felt that was really important, to say now as we're starting this new structure. They're there for us. There's a resource, so we need to use them.
This is Craig. If I could just, I know I'm on all the NIMS process stuff, just because I've had a lot of repetition in it. But I want to say, I think Lawrence has an opportunity to be innovative in this national incident management structure. So when everybody takes that training, you're not going to see in the command staff an equity advisor as a role. And I think that may be an opportunity to amend the national model. And I think it would be a good idea, as we've done here. So when I say command staff, there are specific points of public information officer, safety officer, and liaison officer, 3 that are established roles that every structure should account for. We've added one as equity advisor, and I think it may be something that will take off. So I'm proud of that. I think that is a good place for it to be. And as I mentioned here, I think we made a mistake the other day in not including our command staff, all of our members in our meetings, which won't happen again.
Robert, this is Dan, and I'd just like to point out the comment I made in the chat box around that equity objective. And my push would be that we aspire to do more than just think about equity, but that we move to action on that and look about morbidity and mortality around COVID. So I'm throwing that out in the chat for consideration.
And Robert, I think that one may work as either adding that one to maybe even making it a separate objective, adding it as a second after the ensure equity perspective tools and resources are integrated. And then I think Dan's gets a little bit more specific. That might be a good add. I don't know if it works best to massage it into something else, but to let it stand on its own.
Sure. I see what you're saying. Well, I think, because the equity team hasn't really had an opportunity to digest this yet. And we've got time this week before we start our operational period next week with this. So I would ask that when we get this out to you guys, just if you get it back to us with your suggestions and ideas, and then we can incorporate them and then get a final approval from the command staff here. So
when's the deadline that you would like to have that back, Robert?
It'd be nice to have it by the end of the week so we can get going on it early next week. So maybe close of business on Friday.
So
Thank you.
Robert, when you Say final approval by the command staff. The command staff is the equity advisor, the liaison. I don't see the org chart in front of me, and my NIMS train is
sorry.
failing me. But right, so
Mhm.
so the
So-
equity advisor will be weighing in on the final approval.
Of course, yeah. So what I'm thinking is that once we get this to what we think is everybody's inputs included, then we will get it back out to you through email, or and then when we meet for the first time next Thursday, then we will review those objectives and ensure that everybody is on the same page and everybody is good with moving forward with them. Does that work?
That makes sense. This is Erica again. And so, yes, I agree with that. And I do appreciate that we are leading with equity. I think that's really, really important. Again, I would like us to consider until equity is truly operationalized in everything that we do and becomes a part of our culture and just how our default and how we think and how we approach decisions. I would like to see equity incorporated a little bit more into the body of the objectives. That's kind of where, but I think it's great as it reads, but I would like to see it incorporated a little bit stronger.
Great. So we'll look for those ideas that you have or your team has, and then we'll get them in here. So thank you. Any other conversation? Any other input from anybody on the call about what we're doing and where we're headed? Okay, so just to wrap, then there will not be any more of these Tuesday meetings for now. The Thursday meeting for Education and Unified Command will not happen this week. Next Thursday, the 15th, will be when this Unified Command meets for the first time. You will have calendar invites canceling meetings, and you'll have calendar invites inviting to the new meeting. You will receive, it would be early next week at this point, you'll receive another draft of these objectives that we'll push out. And then when we meet that first meeting next week, next Thursday, we'll review those objectives and finalize those and approval. So we will work, emergency management will work with the new branches and actually all the branches as needed to help with objectives and help facilitate or coordinate whatever we can do to help. And if we need to help you with staff, we, for note taking, things like that, we will offer that out as well. And that's all I've got. Jillian, do you have anything?
We will keep you all updated on some NIMS training. They're funny enough to get a text in the middle of this conversation about NIMS training. So we may be able to offer some things, but as we get more information, we will share that. Sometimes the online stuff is, again, dry, and sometimes you don't have time to sit in a Zoom. So there may be a couple of options available to folks that haven't taken it or just want an update on how this stuff works. When we introduce the new folks, there may be some contact information. I think most of everyone who's been on the team, we have everything we need. But as we bring in our new personnel, we'll be looking for some contact information. Mostly looking for, again, email we'll pretty much have, but a cell phone number in case we have to call the team together very, very quickly. And that way we can send that out via Everbridge if we needed to have an emergency meeting to get people together. So just those two things coming down the pike.
And the updated structure, once we get all the names in there, we'll get that out to you via email.
I promise it'll look better soon with everything looking clean with heading. So that's coming as well.
And we'll add narrative like we've done in the past on that page, so anybody who's looking at it can get a basic understanding of what's going on. So if you'll remember, we did that with the last unified commands to help out. Okay, well, thank you everybody for your time this morning and your work, and we'll continue working and be in touch real soon. Thank you.